Good afternoon, everybody, and welcome to another conversation. Breaking the silence is what I've called these series of interviews with relatively first-time whistleblowers. And Kevin Watts is joining us today. He is a mental health nurse, has had a 40-year-old, I know he doesn't look it, 40-year-old career in mental health with the NHS, spanning the COVID era. He was working in mental health liaison. And as we went through the COVID pandemic years, we ended up moving into addiction medicine. But has got quite a story to tell, Kevin. So welcome to the conversation, and thank you for your time.
Thanks for having me. Pleasure to be here.
And I know you're from my neck of the woods, where you don't have to say where you are, but you've definitely got a Brummie twang.
I'm not actually a Brummie, no. I do work in the Midlands. I was born and raised in Rugby, did my nurse training in Leicester, and at the moment I'm working in a hospital in the Midlands, in the West Midlands.
Yeah. And your career is kind of now you're sort of working part-time, you were saying?
Yeah, I hit 60 last May, so I went down 3 days a week, which kind of suits me.
So you've done your time.
I've done my time, yeah.
Time. So really, I just wanted to sort of go through with you your experience really of the last 4 years of strangeness, really, both from what you've seen in your own career, what you've seen outside, just from generally in the NHS, and also we're going to touch on sort of the mental health impact, given that you're a mental health nurse, on all of this.
Yeah,
but take us right back to the beginning. So when we first saw the people collapsing in Wuhan, the streets of Italy.
It's certainly been a very strange time. So at the time, so we're going back to March 2020, I'd actually been on holiday. I was on holiday in the Peak District with my wife, and the COVID sort of news was breaking in this country, but not too much. And then about a week, literally a week after we got back from the Peak District, the lockdown sort of started. And like you say, all these videos of people dropping dead in the street in China. Straight away, that looked very suspicious to me. And to be honest with you, I knew something was off from day one, not because I'm particularly smart or clever, but because I've been aware, I think for some time, that there's a broader agenda here around the WHO and controlling, pushing agendas to control people's health. Going back to, we could talk a bit about the swine flu sort of hoax, if you like, back in 2009. I'd already read up around that, so I was aware that things weren't as they were purported to be. So straight away, I sort of sensed that something was off. And then as the COVID thing went on, I was working in mental health at the time in a mental health liaison team. And as things went on, there were just so many red flags, things that didn't make sense.
You're trying to tell me that you didn't believe it was caused by somebody eating bat soup just down the road from the Wuhan?
No, let's just say I was a little bit suspicious. Yeah, I mean, I think all the evidence, even from the early days, really pointed to gain of function research. It came out of a lab, either accidentally or deliberately. I'm inclined to think it was a deliberate release, but people have their own views on that. But it was just highly improbable that it was a zoonotic sort of transmission.
But you smelt a rat, really, or should I say, smelt a bat?
Smelt a bat. Yeah, absolutely. Yeah,
we already know about the gain of. I mean, that's a confirmed thing now, isn't it? There's no other word for it. It's bioterrorism, really. If you're creating something more pathological out of something that's fairly benign, like a coronavirus, then you're adding pathogenicity to something and hence creating a bioweapon. And why people can't acknowledge that is beyond me. So what were your first kind of direct inclination? So in your work at that time, you were doing mental health liaison.
So
people dropping in the streets?
I didn't see anybody. I only have, to this day, there's only one person who allegedly died of COVID that I know. And ironically, that was my own father. But he was 96, almost 97. He died in April 2020. But he had multiple comorbidities. He had dementia and got a bad flu or cold, which is probably what saw him off in the end. But of course, they tested him for COVID. He was in hospital, the hospital where I was working, funnily enough. So he tested positive and he went down as a COVID death. I don't know anybody else.
I mean, again, we saw a lot of that. People were on admission to hospital. You'd only have to cough. They do a PCR test. If it was negative, if at first you don't succeed, test again. So they were doing it and they were putting people on the COVID ward, even if it was negative for COVID as well. We've had cases where we've heard that as well. So you've had this one kind of alleged COVID death, but you're suspecting that, it was probably an incidental positive.
Yeah, absolutely. But at the time, I was working in what is one of the busiest A&Es in the country, I've been told. I didn't know that at the time. I subsequently learned. I worked in one of the busiest A&E departments. Normally would cater for 60, 70, 80 people at a time, often more than 100 people in the department. Mm. And I went in this one day, can't remember, I don't think it was a weekend, but I went across. It was just a day shift. I was called into A&E to assess somebody who'd probably taken an overdose or something. Can't remember, self-harm, that kind of thing we dealt with. And literally there were 9 patients in A&E, 9. And there were more staff than patients. And I was looking around thinking, where is everybody? And the staff were just like standing around waiting for patients to come in. I've never seen that hospital or any hospital so quiet.
See, this is what I find it quite strange, Kevin, because again, this is one of the things that sticks with me. When I spoke out earlier, I was saying, look, I was going into the hospitals and they were empty. Scenarios that you've witnessed, and you're made to feel like you're crazy. How there's this sort of disconnect between people who still to this day tell me the hospitals were packed to the rafters, the ITUs were packed to the rafters. You get home and watch the BBC and they were plugging that narrative. But at the same time, my experience and your lived experience were tumbleweeds going through the departments, lots of choreography going on, saw that with my own eyes. But like you say, people waiting to greet the patients as they come in because there was not a footfall. I don't know how to explain that other than, you know, people are lying.
My experience was that carried on right from the start of the so-called pandemic, right from March 2020, all through that, the rest of that year, really, up until the winter, until the time of the so-called vaccines came out. That hospital was just, A&E was just quiet, tumbleweed, really, all summer.
So are you saying that when that vaccine came out, that there was an inflection point towards?
Well, I think. So what happened in just before, about a week before the vaccine came out, I actually switched hospitals because I took on my new role. I was seconded into a role that I'm doing now, which is addiction sort of work, drug and alcohol nursing in a different hospital. So that was December 2020. I was changed hospitals. But what I found very quickly in this new hospital, which is actually a smaller hospital, about a quarter of the size of the one I had been working in, A&E suddenly started to get very busy. And in my role, I've got A&E tracker, so I see who's coming in A&E in real time, all their demographics and what they're coming in with. And I started to see a number of things, but younger people coming in with chest pain, cardiac problems, just coming back to the mental health thing. Prior to COVID, we'd have maybe 1 or 2 teenagers per week come through A&E with self-harm, suicidal ideas, that kind of thing, overdosing. Since the pandemic, consistently, in a much smaller hospital now, I'm seeing, I don't see them personally, but I see them on the tracker. Most days, there are probably 2 or 3 teenagers coming in, sometimes 13, 14, 15-year-olds coming in, suicidal, self-harm, overdosing, you name it. Never saw that before COVID.
What's your view on that, Kevin? Do you think that was part and parcel of the lockdowns and some of the fear?
I think this, in a previous life, I used to be a school drug advisor as well for 3 years. So I have worked in schools. So the minute they talked about closing schools, I said, this is going to be a nightmare. This will have a horrific effect on young people's mental health. So I think it's partly due to the lockdowns, the school closures, the fear propaganda, fear porn, as I call it, which was relentless, wasn't it? You get the ticker tape on the TV screen every day, so many COVID deaths, so many infections. And kids are watching that, and they were told, oh, get the vaccine to protect, when the vaccines came out, get your vaccine to protect granny or granddad. It was the most horrendous psychological operation on kids, which was bound to have that effect, I think.
Yeah, it's one of those reasons I'm heading for the CHOP in the summer. That was one of my concerns. Not only were they vaccinating these younger cohorts that had absolutely zero chance of dying of COVID if they got it, their infection fatality rates were so low. But also the impact of school closures, lockdowns, all the stuff we saw, like you say, the ticker tape, the next slide, please, brigade. It was fear. And I mean, most adults and doctors, and we're all susceptible to that fear. And it was done at a military grade, and there are teams we know that are linked to the government.
Yeah, I agree. Military grade style.
Absolutely. So then these jabs came out. Were you offered a life-saving gene therapy? A vaccine?
I was, and but I tell you, there are many reasons why I declined. I'm not vaccine hesitant. I'm a vaccine refuser. Let's get that clear. there are many reasons why I refused. One of the significant ones was I was working in, like I say, one of the busiest hospitals in the Midlands, including in A&E. At the time, I was working in a team of about 30 to 35 people. It was a nurse-led team with a few doctors kind of stepping in as well to help out the more complex cases, but it was a nurse-led team. About 30 odd people. During that so-called first wave of COVID, probably the vast majority went down with what they would call COVID. They were off with something or other, some of them quite poorly, nobody died, but most people went off with fairly heavy colds, flu type symptoms. And I was in cars with people because we would cover 3 hospitals. The same team would cover basically three hospitals in the Midlands. So I'd be in cars traveling between hospitals with my colleagues. And within a day or two, they'd be going down with so-called COVID. They'd be testing, yeah, COVID positive, and they'd be off for a week or two. I never got sick, apart from very minor sniffles. So by December 2020, when the vaccines came out, I kind of realised I've probably got natural immunity. And I was listening to guys like Mike Eden, Sakari Bhakti, the microbiologist from fairly early on, really, wanting to learn as much about this as I could, because I very strongly suspected I was being lied to, and we were all being lied to. So I wanted to learn more. I did a lot of homework. So Mike Eden was saying probably 25, 30% could be more of people who probably got natural immunity to this. So by December 2020, I'm like, you know what? I haven't really been sick. I've probably got natural immunity. Why do I need a vaccine? And then they started saying, well, we don't know if natural immunity is as strong as vaccine-induced immunity. I'm only a humble mental health nurse, but even I know that natural immunity, as always in the history of immunology, has always been superior to any vaccine-induced immunity.
Conspiracy theorist. One's got some financial benefit to it though, and one hasn't. And I think you can tell which one. So So you were noticing that all your sort of, people were starting to take this jab. How were they faring? So the ones that started to say yes to the old poison dart, what were they doing? Were they getting on well? Were they okay?
What I'm finding now, nobody in the team that I used to work in, as far as I know, has been like seriously ill. But I've kept in touch with people who still work for that trust, and they get like a weekly comms bulletin. And it was on that comms bulletin where they used to be saying, come on, get your vaccine this week. We're strongly encouraging, was the word, strongly encouraging all staff to get their COVID vaccine. And I just ignored them, to be honest. But I keep in touch with Charlotte, who works for this trust. And she tells me that on the weekly comms bulletins now, most weeks they're getting news about young, colleagues in their 30s, 40s, sometimes 20s who are very unwell and have died suddenly, is the kind of phrase, isn't it? People dying suddenly. Much more than ever used to happen. You'd hear about the odd colleague dying sadly at work, maybe every few years or something. But now apparently in this trust it's becoming regular. And in my own
numbers are numbers, aren't they? These numbers are numbers, aren't they? These fatalities are fatalities. They're not conspiracy theories. But if you keep seeing a coincidence happening, then it's no longer a coincidence, is it?
That's right. Yeah. In my own trust now, I've seen people who have taken quite a number of jabs, and they just seem to be off all the time with coughs, colds, and they're what would probably be a normal cold for you or I might take 2 or 3 days to get over. It's taking them a week or two to get over just probably a fairly basic cold, and then they'll recover, and then a couple of weeks later they're off again.
So shared experience, Kevin. Absolutely. When I see the footfall in GP, I very, very rarely work in the NHS now, but you're seeing these people, and they've got one common denominator. They've had 3 or 4 of these jabs, and I'm not seeing the unvaccinated cohorts in. I wouldn't say even similar numbers. I'm just not seeing them, because there's a lot of factors to that, because there's a lot of trust been lost. But what do you make of this statistic about NHS staff stopping after 2? So I think the study showed somewhere circa 80% of people in the NHS across the board stopped after 2. Do you think deep down these doctors know?
Oh, I'm sure a lot of them do. They're not speaking out, at least not to me. I think deep down a lot of them do know. They must have some inkling that there's something not quite right. I have known 1 or 2 people at the hospital, again, the hospital I work in now, that after their second jab, there was 1 nurse that lost the sense of smell and taste, which I think has persisted to this day. one of the people who worked in A&E, one of the A&E trackers, had a jab and had to be rushed straight up to ITU. She developed breathing problems, basically struggling for breath, went straight to ITU. So I have known a few people actually have reasonably severe reactions.
Are these things just brushed under the carpet at trust level? They're not talked about. You've obviously seen this collapse, whipped off to ITU, and then just nobody talks about it again to make that connection.
Well, just to give you an example, they've got what's called a vaccine, a rolling vaccine team at our place. So you'll get 2 or 3 nurses, they're sort of sister level nurses. They'll come round and do sort of roving checks. I was working in A&E Miners a couple of years ago now, and just writing up some notes, patient notes. And this sister comes, oh, have you had your COVID vaccine, or vaccines actually, because now they're offering the flu jab and the COVID jab on the same day, different arms. So they've got roving vaccine teams that actually go around looking for people. My colleague was naive enough to take them up on that offer, and she has her jabs every day. Every year, not every day. She probably would have them every day if they asked her to. But yeah, but at the moment she's getting quite bad headaches, I gather. She's had some bad coughs and colds and things, so her immune system seems a bit below par.
And are they twigging it like in their own mind? Do you think they're just, is it sort of buyer's remorse? So you just don't want to know, you don't want to attribute it to their decision?
I think a lot of this is to do with cognitive dissonance, which we can talk about a little bit, because obviously this kind of ties into psychology and mental health, really. But I think some people are still unaware, actually. I mean, I've had a conversation with this colleague about something else, about big pharma corruption generally. And her response was, well, surely they wouldn't sell these drugs if they weren't safe and they hadn't been properly tested. I wasn't talking about the COVID jab. I was just talking about mental health medication in general, because I've got big issues with a lot of that stuff. But she was like, oh, no, they wouldn't put this stuff on the market if it wasn't safe. And tried to stop myself rolling my eyes at that point. But yeah, some people are still very naive, I think. Some people are waking up, for sure. And I think once you're awake, you don't go back to sleep.
Yeah, and there is that, isn't there? Like you say, cognitive dissonance about it. I mean, it's very clear. You only have to Google Pfizer's litigation history and see that these guys have got track records, across.
That was another reason why I didn't take the jab, because several years ago, before the pandemic, I was reading Peter Goetsche's book. I don't know if you're aware of Peter Goetsche. He's a professor.
Yes.
Yeah, a Danish guy. Yeah. One of his very good books called Deadly Medicines, Big Pharma and Organised Crime.
Yeah.
I've read that book. So when the vaccines came out, and who's making one of the vaccines? Pfizer, paid the biggest criminal fine in history. I'm like, hang on a minute, I'm not so sure about this.
And then you've got companies that have had absolutely no involvement in any vaccines in their whole trading history, Moderna, and they're suddenly specialists in gene therapy, and then AstraZeneca and their monkey viruses that they were popping into people's arms just a few months before the old monkeypox had number one.
That's exactly what it is, gene therapy. My boss sort of spoke to me once and said, oh, you're going to have your COVID jab, COVID vaccine. And I said, this is not a vaccine. I don't consider it to be a vaccine. I consider it to be experimental genetic engineering.
Well, it says it in the documents, Kevin. I did an interview with a lady called Sonia Poulton once where I'm holding up the documents.
Oh, yeah, I know.
And I've run my finger along. It says this is not a vaccine. It's an immunomodulatory gene therapy that will never be used on humans. I'm paraphrasing slightly here, but that was 6 months before it was being used on humans, and that was at the Moderna and the Pfizer. So I posted this interview on YouTube and LinkedIn, and you can guess what happened next. I got suspended permanently from both platforms for spreading misinformation, which censorship that was going on for dissenting voices. It was horrendous. It's not just a case of shutting down conversation. It was a case of actively going for people like myself and other doctors. We all know the small band of doctors and anyone that's spoken out, and we do live in a culture in the NHS of zero tolerance to the often promoted whistleblowing. So how close to the line did you get? Because I think you went quite close to the old mandate coming in.
So yeah, the NHS mandate was coming in. I joined the NHS 100K group. I got my sweatshirt, went on quite a few demos. I've been to London about 6 times, Birmingham 2 or 3 times.
So for those who don't know, can you tell us a bit more about that? There's 100,000 NHS staff here, so not just a small band.
Yeah, no, probably I suspect more than 100,000, but the government admitted probably 100,000 staff, NHS staff, frontline staff mainly, or largely, would were refusing the vaccine, but initially they were still planning to bring in the mandate on the 1st of April 2022. And I'd very clearly made my mind up I wasn't going to have it for all those reasons. I didn't think it was safe, effective, or necessary. I felt I had natural immunity. It had been rushed out. One of the companies making it had been, convicted fraudster. All those reasons. So I definitely wasn't going to have it. But then, as the time got nearer and nearer, we were told that we would have to have our first jab by, I think it was about the middle of February, in order to get the second dose by the 1st of April. And so by about, I think it was mid-January 2022, I actually contacted NHS Pensions and said, look, can you give me a projection for an early retirement pension, please? I anticipate, I didn't spell it out, but I sort of let them guess. I said, I anticipate I won't be working in the NHS after the 1st of April, and you can probably guess why. So they actually sent me the paperwork, which I started to fill in. And I guess, again, my boss came over and said, oh, do we have to do this? Sure you want to do this? I said, well, yeah, unless the government changes its mind, which it didn't look likely at that point. But then within a couple of weeks, they did back down, I think largely because strength in numbers, I guess.
I think it was. I mean, I remember Sajid Jabhead, as I call him. It wasn't very apologetic. It was almost like we can't afford to be without these 100,000 doctors. But I'll need to remind these staff that their responsibility is to their patients. So I almost had a little veiled dig at them for being so selfish and disgraceful to not take something that doesn't stop transmission, as we know. Never looked into transmission. So how they were mandating something that was not stopping transmission. So you weren't saving your granny.
Yeah.
But if Doris has had her jab and it works, then it doesn't matter if Kevin or Dave have had theirs or not. Because their safe and effective jab is safe and effective, allegedly. Yeah. So do you know many colleagues that kind of lost their bottle at the end and took it because it was getting so close?
So I'll give you it's kind of a funny story now looking back, but it wasn't funny at the time. And I met up with her just last week. She sort of was working over at my hospital covering. So this young lass, out of the team of about 35 of us, only 3 of us refused the jabs. Myself, another guy in his 30s who thought very much like me, and a young girl in her mid-20s at the time who was worried about potential impact on fertility, which I think was perfectly reasonable concern to have.
Yeah, well, they did no reproductive toxicity studies, did they?
No, absolutely.
So somebody saying it's not going to affect your fertility is lying through their bloody teeth. So,
absolutely. And it's always been a massive no-no, hasn't it, not to give anything to pregnant women.
Yeah. Well, I mean, one of my big complaints is about exactly that. Doctors were going out and saying it's safe in pregnancy when we all knew that pregnant women were not tested upon, and the ones that were tested upon didn't have great outcomes. The ones that were incidentally pregnant and didn't know and entered the trial unknowingly pregnant, a lot of them lost their babies, and a lot of them got sick. A quarter of them had severe adverse events. But so tell me about this lady you were saying.
And so what happened was she couldn't afford to take early retirement like me. Like I say, about 25 at the time, 26. It got closer and closer, and as I say, I think the cut-off date was the middle of February to have had your first jab, which then enabled your second one by the 1st of April, basically. So she actually booked into the last jab appointment that day, on the last day that she basically had to, it was the last possible date in order to get the jabs in time. And on that very day, I think that morning or whenever it was, the government announced that they were backing down on the mandate. So she just didn't turn up for that appointment. But the point is, if the government had mentioned that and made that announcement a day later, she would have ended up having her first jab. So she escaped by the skin of her teeth, really.
Well, there's many people like that. I mean, they were on about sacking secretarial staff at a surgery I was at, receptionists again, people that weren't patient facing, and they were sobbing on my shoulder saying, well, what do I do? And it's the ethics really of it all. And that's what I wanted to really move into now. Ethics, one of my stands was the lack of informed consent. Wherever there's coercion, that invalidates informed consent. And it kind of says it on the tin. You have to give some information for it to be informed consent, and allow the patient to make a valid refusal if they've got capacity. We see that in things like Jehovah's Witnesses and blood transfusions. If a person says with capacity and they're aware of the consequences, I don't want something, then prior to 2020, that was valid. I've seen people die from not having their blood transfusions because of one sentence in Leviticus in the Bible. But so yeah, it was a strange situation. What was your experience of the unethical aspects of the whole shebang?
So I do think, well, the bottom line is, I think every single, I think there's 10 points in the Nuremberg Code, if I remember correctly. I think, to my mind, every single one of those 10 points has been violated. The whole Nuremberg Code has just been ripped up and thrown on the bonfire. So there was coercion. Like I say, we used to get weekly communication bulletins from the trust saying, we strongly encourage you, we strongly encourage you. Just to turn the clock back a little bit, what first raised my alarm bells really was going back, if you remember, I don't know if you were working in the NHS in the previous autumn, autumn and winter of 2019. Very strangely, for the first time ever that I recall, we were getting emails asking us if we wanted the flu vaccine, and they were really starting to push it quite heavily. I'd never seen that before. And not only that, not only were they pushing the flu vax, we actually had to give a reason why we didn't want it. And I'm thinking, well, this is very strange. Did you notice that yourself? Anything like that?
No, I mean, for me, it's always been a straight, Dave, do you want the flu vaccine? Bugger off. And then they leave me to it. But I saw the switch when the COVID came out, because it was, like I say, incessant texting from the GP surgery. You know, people have been having daily texts, even now in 24, 25, barraging them, saying, you know, you need to have your 79th jab or whatever it is. But there was that incessantness about it. And you know, you've got to have it, you've got to have it, you've got to have it. But you saw that with the flu jab by the sounds of it.
Yeah.
You need to give a reason. It's no one's business.
No, they wanted a reason, and I just said I declined, not giving it. You know, it's unlawful to ask me for a reason. Had to give a written reply, which that sounded very strange. Knowing what we know now, with COVID coming the following year, kind of makes sense. I think it was all sort of prep really. So I saw a lot of coercion, a lot of shaming, a lot of guilt tripping. You're irresponsible. You're a granny killer. You know you should be ashamed of yourselves. Don't you care about other people? All that stuff that we were all subjected to many, many times, which was totally unethical, I think. That just strengthened my resolve personally. I thought, well, if something is really so safe and effective and necessary, you don't have to advertise it and really push it, do you? People will be...
Speaks for itself, doesn't it, if it works?
If something's so great, everybody will have it. You don't have to sell it. It'll sell itself. But the fact that they were pushing it so hard, I remember Matt Hancock's crocodile tears on Good Morning Britain or whatever it was. Why can't people see that that was just so fake?
I mean, it was one of the worst pieces of propaganda piece. That was when he's like rubbing his eye and he's just almost smirking at the same time. You can
absolutely, he was smirking,
see him do it, and then they're prancing about on Celebrity Get Me Out of Here. I don't know how they're not. I won't say what I was going to say actually. I don't know how they're managing to stay out of the criminal justice system. Well, we know because the criminal system is run by criminals, but that's another part of it.
I remember Bill Gates as well being interviewed on BBC. I think this was before the vax came out. It was May 2020. And the BBC was so grovelling and sycophantic and saying, oh, thank you, Mr. Gates, sir. Aren't you wonderful, sir? Oh, when can we expect a vaccine? They didn't ask him one single difficult question. It was a totally grovelling interview. I don't know if you saw that one.
Yeah, I mean, he's a guy who worked in Microsoft Computers. Suddenly he's now chief pharma, vaccinology expert, etc., etc. And I don't know how the lay people can't see that as how is he this expert in everything? This individual, how's he walking free?
Yeah.
Follow the money, as they say. Did you ever see any sort of unethical things? I mean, I'm thinking things like refusal of treatment. You know, I've seen people kicked out of A&E because they refuse testing or masking or you're unvaccinated.
I've not really seen so much as that because, well, when the vaccines came in, I was working in my current hospital now, but I always start off in A&E. We have a sort of set schedule for the morning. So we start in A&E, go there first, and then to the sort of acute medical department, AMU, and then on to the wards. I've not personally witnessed people being refused treatment for not having the vax. I'm not saying it hasn't happened, it may well have happened, but although I'm sort of frontline, I'm not directly involved in delivery of general medical care, if you like. I'm called upon when people coming into they come into A&E in acute alcohol withdrawal or any alcohol-related injuries. They're turning yellow, you know, they've got end-stage liver failure, that kind of thing. They want maybe needing a detox. So I'm not kind of directly involved in seeing when people are refused treatment or not, but I suspect it probably does happen. I'm sure it does.
You're seeing like a lot of like PTSD, almost. That's what I call it. Like,
well, I think there is some PTSD, but most concerningly for my line of work, which is predominantly alcohol. Prior to the COVID, the first lockdown, alcohol-related deaths nationally were going up about 1% a year, steadily about 1% a year, which was sad enough, but sort of fairly predictable and fairly steady. In that first year after COVID lockdown, alcohol-related deaths nationally went up 20%. And the amount of people that have spoken to me when I'm doing an assessment, when did you start drinking more? When did alcohol become a problem for you? When do you think you became a dependent drinker? So many people tell me first COVID lockdown. They were at home, they were maybe furloughed, they couldn't see their family or their relatives. They just started boozing more. It's had a massive impact on people's mental health.
So like a numbing agent, really, to block
Absolutely, yeah. Yeah, yeah.
Have you seen? I mean, there's been a lot of papers around, and I publish on my Twitter feed, X feed, a lot of things around neuropsychiatric disturbances. After, I know your line of work's slightly different, and you just commented on the sort of uptick in alcohol and drug-related things. But are you seeing people getting neurologically or psychiatrically unwell as well?
Yeah. Well, again, this is difficult to prove, as you'll appreciate, but I've seen a few things. I've just talked you through 2 or 3 things that I've seen. So there's a young guy, I think late 20s, early 30s. He was a cocaine user, but he came in, he'd had a seizure, quite a significant, long-lasting seizure. And he had used cocaine the day before, but less than he normally uses. So I was sort of saying, well, is there anything else that's been different in the last few days? And he said, well, I had my AstraZeneca jab, second jab, a couple of days ago. So who knows? I suspect it may have been due to the vaccine. Just to come back to the nurse, the young nurse that nearly had to have the vaccine, but backed out on the last day kind of thing. Her partner did have the vaccine. He did have a seizure as well. So I know a couple of people who had query. Well, I think in his case, the nurse's partner's case, I think almost certainly vaccine related. The guy that was the coke user, the doctors were saying, well, this is cocaine. I'm not sure. But in terms of neuropsychiatric stuff, I remember a lady in her early 60s who came in, she wasn't a client of mine, but she came in with an acute kind of psychotic reaction. So I was still having close links with the mental health team at the time because we sort of worked together, do joint assessments occasionally and that kind of thing. So this young lady, sorry, not young lady, 62-year-old lady, acute psychosis, no history of psychosis. She'd got a history of anxiety and depression, but nothing like this. And she'd had, I think, one of the boosters not long before that episode. So again, I can't prove it was the jab. And so what happened, they treated her with antipsychotics on the ward. She went home with the crisis team. The crisis team were planning to do their first home visit, I think, on the Saturday morning. She was discharged on the Thursday, something like that. So 48-hour follow-up. And then the crisis team, when they visited on the Saturday, they got no response, and basically she was dead at home. So I suspect there was some sort of neuroinflammation, brain inflammation process going on there with that lady secondary to a booster jab. I can't prove it, but it's very unusual, as you probably know, for somebody to have a first episode psychosis in their 60s.
Yeah, and there's lots of case reports, case series of similar. I interviewed somebody who's going to be released, Philip Bellington's son. I'm not breaching confidentiality because he's talked about it on a previous episode, but again, just became psychiatrically unwell on a background of fit and healthy mental health and physical health within hours of his first jab, and then died subsequently to cardiac and the pulmonary emboli after the next one. So that story's coming out, but lots and lots of case reports of everything from, you only have to type in things like variant CJD, or what they're calling variant CJD, and the COVID vaccine, sort of almost like prion disease presentations in jabbed up patients.
I've seen
personality changes.
I have personality changes. Yes, I've seen some of that, and also quite a few elderly patients who are, they're pre-morbidly, they've had a good functional status, and they get their jabs and they seem to go downhill quite quickly cognitively. They're doing CT scans, MRI scans. It's not showing anything particular, maybe just the normal sort of age-related changes. But yeah, they're sort of changing personality, and cognitively they're in quite rapid decline often.
Yeah, it's that critical thinking again. We've noticed that in younger cohorts, one of the most common sort of vaccine injuries and is that cognitive disturbance, brain fog, mental fatigue, jumbling words, and like you say, they get their CT or MRI, and you get exactly what you've just said: age-related white matter changes, and they're not doing the tests that are particularly picking up. They're not. If you don't look for something, you don't find it. And surprise, surprise, there's not even an acknowledgement of the prion aspect of what I've just talked about, or the neuroinflammatory thing that you mentioned. We're seeing that in really strange presentations in vaccine injured of physical problems as well as cognitive, where they've just got stuff that just doesn't make sense. And they go and see their neurologist and they say it's functional neurological disorder. I think that's one of the top diagnoses coming out of long COVID clinics, etc.
Yeah, FND certainly used to be a thing back before COVID, because we used to see a fair bit of it in the big hospital I worked at. But I think there is more FND being diagnosed now. Yeah, you're right.
You get these confusing presentations, and obviously all the tests are normal. These patients have got this cacophony of physical and mental symptoms. It doesn't really pigeonhole very well into a diagnostic criteria for anything. They're almost like MS type presentations. And then they just get told, like, because they're not doing the testing for MS, and the MS test is negative. And obviously then they're saying functional neurological disorder, filed under non-epileptiform attack disorder, etc. What have you ever seen any other ethical breaches? Just going back to ethics, have you?
Well, like I say, just the coercion really, and being made to feel guilty and ashamed if you didn't take the jab. I've not witnessed personally sort of bad practice. I did work with a guy who was quite proud, and I had to bite my tongue. He helped set up a vaccine clinic in a town sort of not too far away. And he basically came to see me one day, and he was very happy and smiling and quite proud of the fact that he'd personally jabbed about 200 people that day. He'd been going all day from the morning until sort of quite late in the evening. And he said, "Oh, great, a great success. We did, I did 200 people on Saturday or whatever." And I didn't know what to say. I was speechless. I just thought, if only you knew what you're doing.
And they don't. And when you actually pin them down, I had a similar conversation with the practice locally to me. This was a vaccine coordinator for the whole of Cornwall. Happened to be on the end of a phone asking for a job at his surgery, and I schooled him for 40 minutes. I said, "Look, you've been telling pregnant women it's safe. Did you know that pregnant women weren't part of the trials? The JCVI refused anyone under 17, and then the government rode over. Did you know that?" And they didn't know. They don't even know it's a gene therapy when you pin them down. And as you mentioned, there's this kind of perverse pride in jabbing. There's lots of doctors that have gone public about how many jabs they were giving in a day. Ka-ching, some decent money being earned here.
You've just reminded me, actually, Dave, one more thing, which this in a way kind of convinced me that it was the right time to leave that trust and take up the job I'm doing now. I was basically waiting to be seconded. So there's a music festival in the city where I used to work. And well, I'm going to say at Coventry. I used to work at UHCW Hospital. Let's get it out there, say the name. I used to work at University Hospital, Coventry in Warwickshire. It's a big A&E department. It was quiet during the first wave of COVID. So every year in Coventry, they do a thing called the Godiva Festival in one of the big parks, Memorial Park in Coventry. And again, just coming back to the pride thing, and aren't we doing a great job? It made me feel sick. So back in, it would have been August 2021. Bearing in mind, this is a mental health trust that I'm working for, not even a generic health trust. This is a mental health trust. They basically were boasting on their comms bulletins that they were going to be setting up this mobile vaccine jab tent for young people who were at the Godiva Festival. And they said they made a point of saying, even if it's only your first jab, come along, have your jab, or have your first or second jab. They weren't on the boosters by then, I don't think, but come and have your first or second jab. And they were basically boasting about how they were going to roll this out and what a wonderful thing it was. And weren't they kind of heroes for doing this? I had to read that bulletin about 2 or 3 times to make sure I wasn't misreading it. And it made me feel sick to the pit of my stomach, because I've worked with kids a lot therapeutically. Like I said, I was a school drug advisor. I helped set up a young people's drug team years ago, again in Coventry. And my first thought was, so you're going to be jabbing people. Well, 17, basically 16, 17-year-olds predominantly, but potentially younger ones, who aren't at risk of COVID anyway. What's the process for valid consent? Is it going to be written consent? I suspect not. I don't know. But these are people, young people at a music festival who are probably drinking alcohol, maybe smoking a bit of weed, maybe doing other things. Are they in a fit state of mind to give valid consent at that point? I would argue probably not.
Yeah, you raise a valid point. You raise a valid point. There was sort of like pneumatic drilling, I call it, the jabbing, like you say, just that turning up, pitching a tent at an event like that. And I know these happened up and down the country. They're popping up these vaccine clinics in the streets, and like you say, no assessment of capacity. You know, in medicine, you know, capacity can change, particularly under the influence, and capacity to be able to retain, understand, weigh up a decision, and communicate it. They're the four elements of capacity. And if you're three sheets to the wind, and you've had a few, or you've had a sniff of something or smoked something, you're not in a position to, let alone the fact that they don't give you any information. They just take your name, your date of birth, your sleeves rolled up, the drug, it's gone in your arm, you know. And how do they sit back and think that that's not ethical?
And this is my kind of specialist area. I work with adults at the moment, but I have worked with young people around drugs and alcohol. So I'm very familiar with doing capacity assessments. Yeah. That just horrified me that they would even consider doing that with young people at a music festival. Like I say, probably been drinking and smoking or whatever, some of them at least. Where's the valid informed consent?
Yeah. And where's the risk, as you mentioned, of COVID? Their infection fatality rates were 0.00000, several zeros down the line. So there was never a risk. And even the government's vaccine and immunisation board said, JCVI, no, it's not for them. And that's why I rose to prominence in the end. I had a sort of argument with the surgery that I worked at, and they said to me privately, we're not going to get our kids jabbed. And they actually said, we're not going to vaccinate 17 and unders at our surgery, which they kept the word of. But the next day on their website appeared an advert to go down the road. We'll deploy staff over there. And they were just doing it under another roof. And that's when I had a public resignation, and then it all hit the fan, and all the interviews and podcasts and all the rest of it. How have your views affected your personal life and your professional life? Are you labelled now as a...
Well, I remember when the mask thing came in, mask mandates, and it was a very patronising leaflet that I actually printed off and stuck to our notice board at the time. And alongside it, I wrote, "Is this the Ladybird book of mask wearing for 10-year-olds?" It was that level of condescension and patronising rubbish, really. So my boss used to come to me occasionally, and he used to say, "Oh, have you got any new conspiracy theories today, Kev?" You might hear a dog barking in the background. He said, "Oh, you got any new conspiracy theories?" I was known as Kev the conspiracy theorist. Whatever, yeah, I can live with that. So how's it affected me personally? Well, I'm still married, but my wife and I have been separated 3.5 years. She's down in Plymouth now because she took the vaccine, I didn't. And I sort of pretty much did everything bar get down on my knees and beg her not to take it. But her sister is a radiologist at the Derriford Hospital in Plymouth. So she listened to Sarah, her sister, rather than me, because who are you going to listen to, a doctor or a mental health nurse?
Well, I've got a radiologist on later on the week, and there are some terrible stories to tell about what they were seeing on scans. But how did your other half or ex-other half get on? Were they on well after the vaccine?
Well, we've not really kept in touch, to be honest, so I don't know. But the ironic thing was, which I explained to her at the time, several years before COVID, she was diagnosed with lupus. So she actually takes hydroxychloroquine. So I said to her, look, the original SARS in 2003 or whatever, this was found to be a very safe, effective drug for, suppressing the original, you're not going to get sick, or if you do, it's not going to be bad. You're on a great drug here that's going to protect you against COVID. But no, I remember getting this WhatsApp message from a sister at the time. This was sort of March, April 2020. Oh, it's going to be really bad. You've got to be really careful not to, make sure you don't give COVID to Helen, your wife, because if you do, she's going to end up on a ventilator, and there aren't enough ventilators, and she might die. And it was like the insane rantings of a 13-year-old schoolgirl. You'd never guess she was a consultant radiologist. Totally.
But you're the madman, you're the conspiracy theorist, and it's just lazy, isn't it? It's a lazy rebuttal ad hominem, when actually, the conversation we've had so far, there's nothing there's nothing delusional or conspiratorial about it. We were talking about ethics, and we're talking about speed of rollout. We're talking about things that we saw with our own eyes that you can't unsee. So I don't know how this conspiracy theorist Kevin comes about, because you're completely rational.
It's a convenient just jibe, isn't it? Just to label somebody and then move on.
And these people that are against our views haven't got a lot of data to support their position. You don't get an exchange of, and as we saw early doors, you've never seen an anti-vaxxer on the BBC giving their perspective. If Dave Cartler and the anti-vaxxers are crazy tin hat wearing lunatic, then let him make a fool of himself on the TV. Absolutely. That's the easiest way.
It would be very easy to debunk our arguments, wouldn't it? If we were really crazy and we didn't have the evidence behind us, there was no science behind what we were saying. Like you say, get these guys on the radio or telly, give them half an hour, let them debate, assume that the public is intelligent and mature enough, which they are, to make up their own minds. But we're infantilized consistently. We're told, we have to follow the science. That was such an annoying phrase. Follow the science.
Are you finding now that starting to get a bit more sympathy for your views from colleagues? People slowly waking up, patients waking up.
I think a lot of people are. Yeah, a lot of people, like you say, a lot of nurses after the second jab didn't take the booster, and I think uptake now at our place for the booster is only, I think it's less than 10% amongst nurses. So
there is a disturbing trend, though, of these people that have said no after 2 are still happy to give it. I find that I was working at a surgery in Cornwall, and there were 3 nurses all had heart issues after, and flatly refused to have any more of the whatever booster we were onto. Yet they were still jabbing pregnant women and kids as young as 5 at the surgery, whilst having myopericarditis after the vaccine themselves. I can't compute what's going on in that nurse's brain, particularly when we look at why we became the professionals that we did. Why did you do psychiatry? Why did I do medicine? We want to help people. So how this whole blind obedience has come about, it's an absolute criminal masterclass. Particularly as you mentioned, we know people that have got sick quite shortly after, but you can't prove it. There's no proof of the correlation doesn't equal causation, Brigade.
Another one of the massive red flags to me, and there are too many to talk about really, but a massive red flag to me was, if you die within 14 days of vaccination, you're classified as unvaccinated.
Well, the deaths as well. I mean, the deaths, it was in plain sight. It was ticking along the bottom saying these are deaths within 28 days of a positive COVID test. So you get struck by lightning and you had your jab yesterday, you get added to the whatever 100,000 ticking across in the yellow and black, horror style. I mean, we have all been conditioned again to this sort of apocalyptic. I mean, every time you flick on Netflix, there's some sort of disaster. I'm watching one at the moment, Day Zero. It's all about a blackout and it's causing mayhem. Same thing here, these apocalyptic zombification, end of world type scenario. So we're kind of conditioned for that. And then it plays out in real life. And it's almost like it sort of stimulates that fear even more, because you've seen how these movies end.
Yeah, predictive programming. I think it's been around a long time, and when you wake up to the agenda, it becomes more kind of obvious, and you can't unsee it.
Yeah. How are you doing? I mean, obviously, this is like you're to me. You've seen it.
Well, health-wise, I'm fine. I've never had anything stuck up my nose. I've never done a PCR test because they were total flakes. Again, I did my homework on this stuff. I didn't know any of this stuff really prior to COVID, but I had to do a fairly intense sort of masterclass, really. So the NHS still, I think, is using something like 40, 45 amplification cycles on the PCR test. You're going to get a massive number of false positives, aren't you? So I've never tested. I've been, other than very minor sniffles, I've never been ill. Certainly never been bedbound or anything like that. Just the normal, very minor colds that I'm over in a couple of days. Mentally, I feel stronger than ever, because to me, a big part of this, which we haven't touched on, but an important part of it for me is we're in a spiritual war. This isn't just about medicine and about healthcare. It's a spiritual battle, really, between good and evil. And I think a lot of people that I've seen on podcasts and things have spoken about this as well. I feel that quite deeply.
What do you think, in your impression? Now we're going to get deep into conspiracies here. No, I'm joking. What's the purpose of all of this? Is it this great reset? Is it
I think that is a big part of it. And people say, oh, the great reset, that's just a conspiracy theory. Well, no, Klaus Schwab actually wrote a book, which he brought out a month or two after COVID first wave. how did he get it written that quickly and published?
Even if you gave them a copy of the book, they're A, not going to look at it, and B, still deny the evidence of their own eyes, and this is what it drives you to.
Yeah, I think it is about an economic reset. It's about a big part of it for me is the transhumanist agenda. A big part of it is about control, about economic control and things like that. It's about pushing us to a CBDC. It's about, very difficult to say it, but I think the inescapable conclusion for me is a big part of the agenda is about depopulation. Mm. And there are several ways to depopulate, aren't there? You can kill people, but if you kill too many people too quickly, even the fairly stupid people will wake up to that. Mm. So you do it fairly slowly, not too obviously. So you kill people, but you also impact fertility by sterilising people. And you've kind of spoken to that a little bit, talking about the miscarriage rate. Mm. And I think these jabs have probably a massive impact on fertility. Yeah. Well, we know the spike protein accumulates in the ovaries and the testes, don't we? So.
And they knew that, and they told me, it goes in your arm for 2 hours, and it fizzes away. Well, that's not what the Pfizer biodistribution data showed. It shows that the gonads in particular and the bone marrow and spleen light up like a Christmas tree. mRNA factories all told. So, but nothing screams out, trust in a product than the incessant push, the indemnity from prosecution.
And by the way, we'll keep it for 80 years. 75 years, we'll keep the data.
75 years. And again, on the basic level, you go to a colleague and you say, have you read the Pfizer trial data? And they look at you like you've got two heads. That I've suggested such an insane thing to look at the trial data for the jab that they're putting into children's arms and realize these things for themselves. You generally see these glazed eyes from people. I notice now one-on-one, you can crack a lot of these hardened cultists now, if one-on-one in a coffee room, and you just come out with some basic facts about it's not a vaccine, it's a gene therapy. It says it in the Lancet here, or it says it in this document from Moderna here. It's undeniable. So I'm making a lot more breakthroughs in that respect. How do you think the scars of this are going to be felt for a long time?
Decades at least, particularly on kids. It's kids that I worry about, because I know it's a cliche, but they are the future, aren't they? I don't have kids. And I'm glad I don't have kids because of all this. But I decided a long time ago not to have kids for other reasons. But for those of you, and I think you do have kids or a kid, I feel sorry for kids growing up today, because this is kind of being normalised, really. And what messages are they getting? The school closures, the lockdowns, the flu mist vax has been incessantly pushed on kids in school. They're growing up in a culture that's very different from the one you and I grew up in. I think I'm a bit older than you, but the culture we grew up in, it was very different world than today's world.
Very social media driven as well. I do a lot of my adolescent 10-minute consults in general practice I take people through their day, talk me through a day, and a lot of it's around phones and technology. And then you've got all the gender confusion and division.
It's all part of the same agenda, and I think a lot of people can't connect the dots. And I think this is why a lot of doctors refuse to see that the jabs are causing so many harms and injuries, because there's such a diffuse range of different injuries. And people think, well, they can't possibly be connected. How can a brain injury be connected to, cardiac injury or something else, or other neurological stuff, or whatever. But because, like say, that spike protein gets disseminated throughout the body, it's going everywhere, isn't it? Causing multiple issues all throughout the body. But people aren't connecting the dots, and I don't think people are connecting the dots with the bigger agenda. I think it's all part of the same agenda ultimately.
Yeah, I mean, it's took all this time now. We're just starting to see some experimental rollout of some diagnostics. So people can now go and have a test for mRNA-induced spike antibodies. There's some laboratories are doing it, World Council for Health are doing it. And now we can start saying, and I was doing a kind of pseudo version of that, getting patients to have autoantibody screens and inflammatory markers, D-dimers, troponins. And that was really throwing out the theory of functional neurological disorder. If that patient would go back and says, I've got a positive ANA titer, which means that basically the body's attacking its own nucleus, so some autoimmunity, then that throws this gaslighting out the window around a functional neurological disorder. How would you convince so our colleagues, obviously they've been giving the jabs out, they've took the jabs, They're hoping that this kind of all passes and, you know, we can forget about it. What would you say to the sufferers of ostrich syndrome to encourage them to do what's right for the children?
It's not going away. I mean, people, I think my core belief is that most of humanity, people are basically good human beings. There are some psychopaths. Unfortunately, they tend to be in control and have all the money and power. But most people are good, decent human beings. They just want to have a normal, peaceful life, bring up their family, whatever, you know, and just get on with their neighbours and just have a normal life. And they're basically well-meaning people. But if they're thinking this is all going to go away and life is going to go back to normal. I mean, Klaus Schwab himself said, this is the new normal. We're not going back to the old normal, you know, and this is, the COVID thing is just a smaller, you know, small part of a much bigger whole, really, a much bigger agenda. And, you know, those of you who have kids, or those of you in your 20s, 30s, 40s with a lot of life left ahead of you, you know, I'm 61 this year, so, you know, most of my days are over. Hoping for a few more years yet. But those people who are young or you've got kids, what is life going to be like in 10, 20, 30 years time if we don't stop this? Because it's not just COVID, is it? They're talking about rolling out mRNA jabs for cancer, you know, cancer vaccines now, this, that, and the other, mRNA jabs for the flu, you know, goodness knows what else. Where's it going to stop? Despite the overwhelming evidence of harm, serious harm and death, overwhelming now at this point. I mean, anybody that doesn't see these jabs as harmful just isn't paying attention.
Yeah, so there's this dystopian future that they're telling you about. You know, they're talking about 15-minute cities. That's not a conspiracy theory. No. Applications have gone in. You know, we've got this Internet of Things, this interconnectivity of humans, AI, as you mentioned, transhumanist. You've got Yuval Harari talking about humans being hackable. Are we genetically modified? Anyone who's had the jab? You know, there's a debate that people are genetically modified who've had the jab. So hence, are they human anymore? You know, so there's loads of these principles that just, if we don't stop it now, but I don't know what more, you know, at an individual level that people like yourself or me can do other than keep conversing, the purpose of this whole Substack is to get people thinking, and hopefully people will be showing these interviews, conversations between just two normal blokes who've seen and been concerned about things that most humans should be concerned about: ethics, safety, evidence, you know, things like that. And that's what's got me in trouble. It might get you in trouble after this conversation. Hopefully not.
Well, I'm semi-retired. I may be fully. I'm thinking of going next year anyway at 62. So if it comes to I have to take early retirement, it's forced on me. I've made the decision. I can kind of live with that. It's more important to speak out, you know. And those of you sitting on the fence at the moment, and probably a lot of them out there, you know, you've been extremely brave and courageous and put your neck on the line or above the parapet. You know, you've spoken out, you've risked a lot. I'm risking probably not as much as you by speaking out, but there comes a point when you just have to do it, because you can't, you know, silence is complicity, really. If you sit there and you know that something is fundamentally wrong, badly wrong, and that crimes are being committed, crimes against humanity, in my view, and you do nothing about that, you're complicit in that crime.
Yeah, it's just turning the blind eye, or we're just following orders. That didn't go down well first time round at the Nuremberg. And I mean, I get accused of saying that all doctors should be hung. I've never ever said that. I draw the comparisons and the parallels, the obvious parallels between the Nuremberg trials, the Nuremberg Code subsequent to it. And as we mentioned earlier on, all 10 points are equally valid with the mRNA rollout. You know, all points are ticked. You know, and it's just very strange times that we live in, that this complicity and silence, you know, and it's funny because the doctors who are actually silent and hoping it all, you know, disappears, they're the doctors who are going to be replaced by AI, and the pensions won't be anything, you know, that they think it will be in the future financial system. So it's a very odd silence, vow of silence, if you like.
I do think we need sort of proper criminal trials and proper. I mean, the COVID vaccine inquiry is just a complete whitewash from what I've seen of it. I know there's some vaccine injured sort of. There's a representative from the COVID vaccine injured families, but Dame Justice Hallett, is it? I think it is, was kind of saying, "Oh yes, I hear your story. I'm listening to you. Yeah, this is really, really sad, really sad." But that whole inquiry, to me, seems to be starting off on the foot of, well, the vaccines were safe, they're effective, they're necessary. That's taken as a given. They're not really doing any serious questioning.
It's just a strange one, isn't it? Because nothing about that sentence, safe and effective, is true. And it's not, it doesn't take a rocket scientist to see that they don't work. The sheer fact that people have to have 6. I mean, I think even from the antibody responses, we're seeing 8 to 12 weeks worth of response compared to natural immunity, which is lifelong. And so, unless you're going to be having a jab every 3 months, and I mean, they were giving jabs in the autumn for the natural Wuhan strain and the, what's the next one, Delta. But they, in the Omicron era, they were giving autumn boosters for those two. Elapsed, again, without going into the finer points of was it flu rebranded or not, but it's just bad science to get. It's like giving a flu jab out in 2025 for the flu that was circulating in 2010, for example. It's changed so much and morphed. That's at the basic virology level. So it's just bizarre. And you mentioned earlier about giving co-administered, one in each arm. That, I mean, if anyone can show me the papers when they started doing that, there have been papers since, but at the time they were giving flu, COVID, and there was not even animal data to show that it was happening, that it was safe to give a combined flu and COVID booster. Just insane.
I remember you just reminded me, with the Pfizer jab, originally it had to be deep froze, didn't it? Cold storage. And then all of a sudden they said, oh no, it doesn't have to be deep frozen.
That was overnight. Literally, we had when I remember the first lot came in, and it was a backing in, it was a big truck. And then it's as they opened the door, all this sort of liquid nitrogen came out. It's like a scene from Stars in Their Eyes. And, this big clapping and they came out with that went out the window within 2 weeks. And then people were having 1 Pfizer, 2 Zeneca. It's like a lucky dip of Russian roulette, or unlucky dip. Very strange. Final thoughts, Kevin, as we wind things up.
Well, I just hope, like I say, people examine their consciences. If more people spoke out, this could be over very, very quickly, I think. Even if it doesn't take all doctors or all nurses, I think just a relatively small percentage of healthcare professionals on the front line spoke out, spoke their truth to power, said, look, we've got serious concerns about this. That's all it would take, and this would end very quickly, potentially.
We saw that with NHS 100K, just going back to them. It's safety in numbers, and that was a great example of everyone stood up. Yeah, it was a result in the end that we needed. They threw the mandate out for the wrong reasons. They've done it for, because they blamed it on, we just can't do without these selfish staff. But as discussed, but safety in numbers, and it doesn't even take 100,000. It just takes. When we're starting to see now, we've got cancer doctors speaking out. We've got dotted around the country, and we're all sort of joining forces now, which is quite good. We're all discovering each other, these substacks. There's a lot more presence now than there ever has been, and so many stories of awakening.
Angus Dalgleish has spoken out quite a bit, hasn't he? I've heard.
And absolutely vilified. I mean, he's a professor of oncology.
How can you not listen to a guy like that? One of the most eminent oncologists.
There's a lot of eminent conspiracy theorists, according to the world of I mean, you look at people like Peter McCulloch, Rob Malone. He was intimately involved in RNA as a technology, mRNA as a platform. Even had it himself. So I think he had 3. Mike Yeadon, all of these eminent people, but we're all wacky conspiracy theorists. And I always ask the question, for what gain? What did the people think it's fun to do this, to put your neck on the chopping block and face GMC and ridicule and ad hominem names like conspiracy theorist, tin hat wearing, lunatic, etc.
I mean, this is my therapy, really, because to get stuff off my chest in a forum such as this, I've done it once before online, sort of whistleblowing. But if I didn't speak out, I wouldn't be able to sleep at night. I really wouldn't.
Yeah.
Just examine your conscience, and where's your humanity?
That's it. Humanity. That's what it comes down to. We're only here for a short time. Even if we get to our treble figures, and we're here as we look after the planet for a bit. We loan it, don't we? And we look after each other, and we should be. And I don't understand. I really don't understand the mindset of keeping your head down and hoping it blows over. But Kevin, you've been an amazing guest. I think this is going to be well received. I just want to commend you for your bravery, openness. I really do hope this doesn't get you in trouble. It shouldn't get you in trouble. But yeah, you've been an amazing guest, and thank you for your time.
Thank you.
All right, take care, Kev.
Cheers. Bye now.